Welcome to UPLEVEL, Real Health, Real Talk with Dr. Jenna Blasi. I'm Dr. Jenna. I spent years crafting ways to help women thrive, and I want to help you do the same. On this podcast, we dive deep into health at every level, focusing on the mind, the body, and the spirit. This is where real conversations meet transformational wellness. We'll be talking about all the things that truly matter, from nutrition and fitness to lifestyle, mindset, and personal development. Plus, the real deal on managing stress and navigating menopause. So if you're ready to elevate your health journey with authentic, transformative insights, you're in the right place. Let's get started. Hello, and welcome back to UPLEVEL. I'm Dr. Jenna, and today we're going to talk about the issue with personalization in health. Personalized medicine sounds like the gold standard, right? But in today's wellness culture, personalized medicine has become over-testing, over-analysis, over-supplementation, and often a complete loss of body trust. So today I want to explore the difference between useful personalization and more performative personalization, right? Sounds good. This is going to be the change for you. And so looking at when did and what is the point, I should say, when personalization stopped meaning better care and just started meaning endless testing and supplements, et cetera, et cetera. Okay. So we have been taught that the more personalized our health becomes, the healthier we'll be. But for many people, personalization is making them more anxious, more confused, and further away from actually feeling well. All right. There is a point where even optimizing your health can stop helping and start becoming its own form of stress. And then somewhere along the line, like our health became a full-time job, right? Which is why many of us are like, oh my gosh, I don't know if I can do that because we feel that we can't fit it into our lives. So let's talk first about why personalization became so popular. All right. People want answers. Rightfully so. People want certainty. Healthcare can feel dismissive or incomplete. People aren't listened to. And so personalized testing feels validating, feels like you're being looked at as an individual. And the internet really rewards complexity. So when I look at like what's happening with a lot of the people that I see and those that come to me and many of you listeners, you feel often no one is listening. Something must be missing. I'm missing some puzzle to my health. There has to be some deeper meaning here, but those things can be true, but this can also create vulnerability to over-testing, to endless protocols, and to a health identity attachment, if you will. So I'm a fan of individualized medicine. That's what we always want to look at you as an individual when I'm working with someone. Humans are biologically variable. Your response to diet, exercise, it varies based on genetics, based on your microbiome, based on hormones, based on your individual challenges and stress. So precision medicine is a real evolving field. All right. There is individual variability with your response to glucose. There's differences in training responses. There's hormone variability, both as an individual and across the lifespan. So the idea itself isn't wrong. It's actually rooted in good science. But more data doesn't always mean better outcomes. In fact, it often doesn't. Like when we look at behavior science, if we have too much information, too many choices, too many directions, this can lead to like indecision paralysis and overwhelm, etc. So let's look at the over-testing problem. More testing is not always better medicine. Now, you've heard me. I teach that like there's labs that are not being run on you that are important. Your ferritin, which most practitioners are not running, that's an important marker. Your vitamin D, other things that maybe your insulin that aren't being run regularly. These give us important pictures into your health and information. But what we also see on the over-testing side is hormones, tested repeatedly without clinical reason, or tested in a way that's not even been validated by science. Cortisol testing being done excessively. So we're like, oh my gosh, what's happening? What's happening? Stool testing without clear symptoms, food sensitivity testing. And then these interpretations are super literal, and people end up with these huge lists of things they can't eat. And just to talk about food sensitivity testing briefly, companies vary. So you can take like so many, there have been studies, and so many of my colleagues as well have taken like their blood, labeled it as different people to the same company and gotten different results. So reproducibility isn't really there in a lot of these companies, and then sent them to different companies and gotten completely different results. So there's the interpretation of the food sensitivity studies. There's the inaccuracy of, for example, and I know a lot, this is going to like push some buttons. I know a lot of my colleagues do a lot of food sensitivity testing. I don't in my practice for a variety of reasons, some of which I've just listed. And then the other issue with food sensitivity testing for me is it's an effect. Like our food sensitivities increase when our gut is not healthy. So when we actually repair our gut and work with our gut, a lot of those things wouldn't even show up anymore. So even if the tests were accurate, it's a result, not a cause. So then there's like tons of micronutrient panels with unclear clinical relevance, hair testing people do, which may or may not actually correlate to what's going on in their body, and all of these like GI panels and Dutch and whatnot, chasing these like quote unquote perfect results. And then again, like not even really having the clinical validity behind some of the quote unquote functional tests that are being done. So I always, when I'm looking at testing, I always say, is this going to give me information that I really need to be able to understand your situation and treat you? And will it change what I would do? Right? So if I do food sensitivity testing, but I know that the gut is disrupted, will that change what we do? No, let's address the gut. So a test should answer a question, not create 10 new questions. Not create anxiety about health. The number of people who've come to me over the years, and they come in with, I mean, I've been in practice for 17 years or so at this point. I don't know exactly, something like that, whatever the math is on that. And I have had people for years come to me with binders of like fancy tests that they've done, genetic testing, stool testing, organic acid, this, like they have binders of tests they've done, protocols they've been on, and they're not better. They're not better. So like, why is this? Right? So there's a clinical reality that there's false positives that exist. There can be incidental findings. There's over interpretation. There's normal variation that's mistaken as pathology. So when you test enough things, you'll always find something abnormal. But that doesn't mean it's the cause of your symptoms. Doesn't mean it's the cause. And so I like to go upstream and really look at where is this coming from. You know, when we have mold sensitivity, for example, which a lot of people do, what's going on in our system where some people get sick and others don't? And how do we clear the system and strengthen the system and not just keep testing and chasing after? And a lot of times people do testing and they're not even really sure, does this mean I have something now? Does this mean I had something from the past? And then we get stuck with a health identity like, oh, I have Epstein-Barr virus, and we just keep testing and testing, waiting for something to change rather than really focusing on how do we just get ourselves feeling well? Because we can go down, you all, if you've listened to me, you know I'm big on root cause. I want to get to the root cause. If someone's thyroid is out, I still want to look and go, well, what are their adrenals doing? What is their stress pattern? Why is their body struggling to have optimized thyroid function, for example? But this can, the root cause can also lead to a lot of rabbit holes, right? Let's look at root cause rabbit holes. People become trapped chasing like increasingly obscure explanations for things. Hidden infections, adrenal fatigue labels, mitochondrial dysfunction claims, parasite obsession, nervous system dysregulation as a catch-all explanation. And you know that I address all of these. Like as an individual, I just mentioned adrenals, right? We might need to support your stress response. We might need to look at your cellular health, and nervous system for sure. But we can go down these rabbit holes of just chasing Lyme and mold and hidden infections and this and that. And I'm not saying these things are not real. Okay. Please do not misinterpret what I'm saying. But what I'm saying is we can go down a rabbit hole and then just be not getting better. I mean, this is what I see is people. I had a Lyme patient years ago who had spent $100,000 in treatment and testing and protocols, and they were not better. And I don't think that's that uncommon in the Lyme world. And then also, I mean, I know a lot of people who've been sick from mold, but again, let's address, what's going on in our house for sure. If we've got mold, let's also address the terrain and not just go after the thing. So like people ask me about parasite cleansing a lot, and most of us are exposed to various things. Do we actually have a parasite that is causing symptoms? Right? Like you went swimming in a river with, Giardia. So do we have a parasite or some type of bacteria that's actually causing symptoms? Or do we have a system that's made us susceptible to a lot of things? Right? So if you actually have an infection, absolutely go after it. But we can just keep going down these rabbit holes of chasing this what's almost like sterile, right? We're looking for like a sterile inside versus maybe just resilience. Because I'm going to be exposed. You're going to be exposed to all types of bacteria, all types of viruses. How do we have the resilience to not actually get sick from them? So I'm not saying these things never matter. There's a really important nuance. I'm not saying these things never matter. I'm saying that like when everything becomes root cause, nothing actually gets prioritized. Or we just start chasing after people can spend years trying to fix their labs, adjust their supplements, changing protocols. And yet some of the foundations are not there. They're sleeping poorly, not from hormone imbalance, let's say, but from sleep hygiene or something else. They're under eating. They're not strength training. They are chronically stressed. They are disconnected from the basics. My goal today is to help simplify and bring clarity to a landscape that has a lot of, or leads to a lot of overwhelm, right? The whole biohacking overwhelm, right? And we're trying to, and I'm big with optimization. I'm big with up-leveling our health and our mindset. But like modern wellness is like, okay, you need to cold plunge and you need to do red light therapy and you should have all these wearables and then get your continuous glucose monitor on there, which by the way, I've seen make most people feel insane and like more stressed and more worried. Get all of these supplements and get these tracking apps. And then you need your personalized routine and then your, various peptide stack and endless health metrics, right? When health becomes a constant project, it can stop feeling like health. And you're talking to a person that is all about health and up-leveling, but we have to find our voice and our intuition in that and our path, because these things can lead and often lead to decision fatigue, to supplement overload, to fear of missing out on the quote unquote right protocol, and outsourcing your body awareness, outsourcing your power and your knowing to the quote unquote right protocol. Even with the people that I get to work with in my practice, we share foundations of health. We educate, we share research, evidence-based information, but people's own knowingness of their own body matters. You've been in your body for how long? 20, 30, 40, 50, 60, 70, 80 years. You know your body. So we want to be open to coaching and to expertise and to guidance to maybe see some gaps in how we're approaching our health, but not in a way that we're giving away our power or overriding our own intuition. All right. The next thing I want to talk about is the loss of intuition. So this can happen with a practitioner you're working with that tries to override what you know or what you feel. This can happen with our wearables, right? So people stop asking, how do I feel? Checking in with myself. How do I feel? And start asking, well, what does my data say? And I've talked about this, like my Oura ring sometimes is not matching what I actually feel. And sometimes I'll be like, oh my gosh, my recovery is not good. What's going on? And then it actually creates unnecessary stress. So I want to encourage you to stay connected to yourself. I love data. What we measure, we can manage. Data is important. In our journeys with people, we do some data tracking, right? We do labs and we do, measurements. We do different data tracking. If people have an Oura ring or something like that, we can track these things. We also track progress. How is your sleep? How is your energy? How is your mood? How is, for the people that are getting sick all the time, how's your resilience been? But the goal is also to stay connected to, well, I don't know why I said but, because a lot of those things help us stay connected. We may not think about how is my energy, how am I sleeping, etc. So people often become disconnected from hunger, from satiety, from energy cues, from recovery cues, from cycle changes, from emotional stress, and we're just running on automatic. I had a patient recently who suddenly started having some symptoms again. She was doing really, really well. Some symptoms started returning, and it happened after she had a loss, like someone that she knew, someone died. And she forgot about that kind of triggered this disconnect and this sort of backwards slipping. And so this is where bringing awareness is everything. Awareness is actually my word for 2026, because to me, everything comes from awareness. And we also taught last night in my member class, like what we notice, then we can notice it and then we can make actual conscious, intentional decisions. So instead of judging ourselves for, let's say you're in a negative mindset, you're like, oh my gosh, I'm really negative. Well, you noticed it. That's wonderful. Don't beat yourself up about it. But now that you've noticed it, you have the power to change it. And so when we get disconnected, we're not noticing our hunger. We're not noticing our fullness. We're not even noticing our wins. We're focused on maybe what's not working. And so some people know every biomarker, but they no longer trust their own body. This is an issue because our intuition comes from a higher place, a higher knowing, and really it outranks any biomarker that you can find on your Whoop or on your Oura ring or, on the scale or wherever. So I have a podcast on intuition, how to distinguish it from sort of emotions and like what's actual intuition and what's emotion. Because the other thing about intuition is it will go against what our senses often is telling us. Like we look out there and we go, oh, well, this is what I should be doing, or this is what I should be feeling. And our intuition is other. And then what do we listen to? We tend to listen to out there rather than within, trusting, because it may not be rational, that it doesn't make sense. There are days, I remember when I would teach a fitness class and my Oura ring would say like, oh my gosh, your energy is amazing today. You're ready to go. And I think I'm actually not. I can tell in my body that I'm not. And I might need to honor and scale back and have, the class. I always like to be like the hardest one working in the class. But on those days, maybe the class works a little harder than me because I don't agree with what the quote unquote data is showing me. All right. So let's talk about when personalization actually helps, because I don't want this episode to sound like I'm anti-testing or I'm anti-individualization or anti-functional medicine, because none of that is true. All right, there are good uses for personalization. Why would we use personalization? Why does individual individualized medicine, individualized healthcare matter. You have a medication response that's different from everybody else. Could be different from the research, could be different from majority of people that your practitioner has worked with. So there's medication response differences. There's hormone therapy adjustments, right? You may start at a different dose. And this is where like people say, oh, like, what do I do? Well, I can tell you, standard of care, what the research says, but you as an individual, maybe I start you a little lower. Maybe I start you at where I would start most people. And then making those adjustments, not based on not based just on labs, but also based on you as an individual and how you feel. Genetics that meaningfully alter your risk, right? A lot of people do a lot of genetic testing. I used to do it. On all of our program members, and then it actually wasn't helping the results. I was surprised, but it wasn't helping the results. Now, there are genetics that meaningfully alter your risk or alter your response that can be useful. If you have unexplained symptoms after foundational workups. And this is where I say, like, with some of the stool testing, for example, when we do it up front, we know the gut's disrupted, you're susceptible to everything, and we're just going after something versus how about we reset your system, get the foundational workup, the foundation set. And then if you're still having unexplained symptoms, then we dive a little deeper. If you're an athlete or a high performer with specific goals, this is a big one because when we look at what choices we make, how we start you on a therapy, how the foundations are applied to you, it depends on your goal as well. Like, what is your goal? So athletes are high performers with very specific goals. We may do more personalization. We may do more specific types of data collection and testing because they have a specific goal where we need that information. Complex chronic illness cases. For sure, a lot of complex chronic illness cases are going to benefit from personalization. And that's where you've slipped through the system of standard of care medicine. Something is being missed in helping you get better. So I want to make a few key distinctions. Helpful personalization solves a specific problem, has a clear question, and it changes treatment decisions. Right? I said earlier, if I'm going to go deep into some type of individualized functional lab test, it has to answer a clear question and change what I would have done and improve outcome. That's the fourth one. Helpful personalization will improve your outcome. And this is the distinction because I see individualization in what we do overall improves outcomes over individualization, right? Where we're not even looking at foundations, that can lead to too many supplements, too much testing. There was a young woman years ago who I interviewed as a potential candidate for one of our wellness programs. And I didn't think it was the right fit for her. Our programs are a bigger investment because they're all inclusive. You get coaching, you get doctor visits, you get labs, you get supplements, you get mindset work. And I just thought, oh, she doesn't need all that. She's young, she doesn't need all that. So I referred her to another naturopathic doctor. That young woman came back a year later and had spent her entire life savings on testing, supplement protocols, and visits, and she wasn't better. And the thing is I see this a lot. She's not a one-off. All right. So when we're going to do personalization, meaning like everything should be individualized. I probably should clarify, like everything should be individualized in terms of listening to you and what your unique challenges are. And maybe you're super sensitive to supplements or medications, or you don't do well with this and you do well with this. Like you have to be treated as an individual. But when we're looking at personalizing every aspect of your care, all right, we might be missing the mark. We want to make sure we're solving a specific problem. We're answering a clear question, that these things that we're doing would change our treatment decision and they will improve your outcome. So on the flip side, what I would call harmful personalization. Harmful personalization creates confusion, promotes dependency, increases fear, and keeps people chasing perfection. All right. So if you're more confused than ever and you feel dependent on whatever it is and you're just in fear, like this is what I've seen with like genetic testing. Some people they're obsessive and they're like, oh my gosh, if it's meaningfully going to change your risk, we should know what the genetic, like I did the brain health podcast and we talked about ApoE4 and when do you test it. So, and then if you're just constantly chasing perfection, I do want to constantly optimize. I want to constantly up level how I feel and because that's growth, but I'm not chasing perfection. That doesn't even exist really. So the healthiest people are not necessarily the ones doing all of this rabbit hole diving into like every area. Okay. Health often comes from, primarily, I would say too, from consistency. I just did a member class on just like consistency and where we have the right identity that helps us become, that affects our behavior, that helps us become consistent and persistent to get the outcomes that we want. So consistency. Health often comes from simplicity. A lot of these people who come to me with binders of testing and protocols, let's strip all that back. Let's get back to the basics. Let's simplify this process for you because we're overcomplicating movement and supplement protocols and health. Body awareness, habits that are realistic that you're going to actually build, right? And then we build bigger. Nervous system safety and strong foundations. Okay, so I want to repeat those. Health doesn't typically come from endless testing and endless rabbit holes and huge supplement protocols. That's another thing is most people that come to me are on baskets of supplements. When I used to see people in person in my office here in Sedona, people would come on baskets of supplements. Even if they're natural, your body still has to break all that down. And is there maybe something deeper, few foundational pieces that haven't been addressed that you need 20 supplements to feel well? I used to be like that when I was in college. I think I told you all, my teacher called it my Hunter S. Thompson trail mix. I had a huge Ziploc of all of my supplements. I was not healthier then. I wasn't healthier then. I actually feel better. I was in my 20s. I feel better now in my 50s, and I'm on a quarter of what I was on then. And I've gone through periods where, I'm taking very little at all. So consistency, simplicity, body awareness and intuition, habits that you build and can maintain and are committed to maintaining over time, nervous system safety, and strong foundations. So here are some questions that I want to pose to you before we close. Are you gathering information or are you avoiding action? Right? All the information in the world means nothing without implementation, without taking action. I always want to inspire people, but if I inspire you and then you don't make any changes, you don't take action on anything you've heard from these podcasts, I haven't achieved anything, right? So are you just, gathering all this information to actually do something with it, or are you avoiding action? All right. Are you chasing data or are you listening to your body? I love data, but I love listening to my body. They can work together, but sometimes they get separate and you're just chasing data. And are you over personalizing what may actually need simplification? One of the things I talk to people about is like, let's streamline your supplements. When people come to me, our journeys are all inclusive. And so I do prefer that they're on the supplements that we have them on while we're resetting and rebuilding and kind of clearing the setting the foundations. And then later, if it's good quality, they can go back on the things that they've been on. But my goal is typically to what I call streamline them. The supplements for them so that they don't need to be on huge amounts of supplements. Sometimes the most personalized thing you can do is stop looking for another answer, another protocol, and just start supporting the body you already have. It's like if you're not moving your body at all and you're like, well, what is the right thing to do? And do I strength train or do I do HIIT or should I do this? But you're not moving. Instead of looking for like, what is the answer? Just start supporting your body. Get out there, start walking, start moving. All right. I believe that personalization should make health simpler, not more complicated. So like I said, I'm always going to look at you as an individual, anyone I'm having a conversation with, anybody that I'm working with, anyone that enters into our programs, but it should help make health simpler, not more complicated. All right. More information is not necessarily going to lead to better outcomes and too often can lead to the opposite. All right. And, a few more things I want to say just before we close is just because a test finds something, that doesn't even mean that's the reason you feel unwell. That's a problem with some of the fancy functional tests is they find something, but it actually doesn't, it's not even the reason. It seems like it is. You look and go, oh my gosh, I have this is why. And then we go after that and you're not better. Now that's not always the case, but it's often the case. We can know every lab marker and still not know what our body actually needs. So I've said this before, but sometimes, it's not the sexy things. It's these foundational things. And they don't have to be boring. They can be a little bit harder to commit to. But anyway, all right, time to wrap up. I hope you found this useful. And we have an expert guest that's going to come on to help talk about like, how do you know what to trust? How do you know who to trust? How do you know, when to personalize and when not to? And how do we sift through all of the overwhelm and overinformation that's out there? So I'm really excited about that discussion. Thank you all so much for joining me. So grateful. Love having you here, and we'll see you next time. Thank you for joining me on this episode of UPLEVEL, Real Health, Real Talk. I hope today's conversation inspired you to take the next step in your health journey, one that nourishes not just your body, but your mind and spirit as well. Don't forget to subscribe so you never miss an episode. And if you found value in today's episode, please leave a review. Until next time, keep learning, keep growing, and keep thriving. And remember, true wellness is a journey, and you are on the right path.